All right, we're going to go back to our coverage of Gaza now. We're joined by Dr. Mohamed Elfar. He's a plastic and reconstructive surgeon, and he's part of the American medical team with Rahma Worldwide. That's an independent humanitarian organization. He's joining us from the European hospital in Gaza. Doctor, thank you very much for your time. I understand that you've just recently arrived as part of a team of American doctors. What is the situation in the European hospital? What are you finding?
Thank you for having me on. The team we have, just a minor correction. We're 19 surgeons from the United States, Jordan, and France. The situation here is undescribable, to say the least. When we came, we arrived Thursday night, and Friday morning, everybody went to the OR just to start their cases. I can give you innumerable stories about that will illustrate how the situation is best. If I say this morning I had to do surgery without any gowns, I had to do it with my scrubs. I've seen patients with minor burns that end up dying just because there's no care. Nothing's available actually to provide them with care. I had
sorry to interrupt you, Dr. Elfar, but when you say that nothing is available, can you tell us what you mean exactly?
Sure. So I'm talking in terms of equipments. I'm talking in terms of supplies. I'm talking in terms of staff. The physicians and the nurses are completely exhausted. When we came on, we asked them to kind of let us give them a relief. However, they still continue to work, and they've been working nonstop for about 4 months now. Over 4 months, and you walk into the OR, and we are practicing an 18th century medicine here.
Okay.
Because we don't have equipments, we don't have supplies.
Okay, so that's what you mean when you say that you don't have anything. What then does that mean for the patients at the hospital, the care for them, their chances?
Poor outcome and high mortality. I'm telling you, I've lost in this week several patients for very simple reasons. We don't have good dressing gauze. We don't have some dressing supplies. Patient gets septic. Patient die because the ventilators are not working well. We don't have enough medications to treat patients with, so it's across the board.
It sounds like an incredibly difficult situation. Can you give us an idea of how many patients the hospital is meant to be servicing, providing treatment for, and the kind of numbers and injuries that you're seeing?
So I don't have exact numbers. However, my understanding from discussion with the staff here, European hospital was not meant to be a trauma hospital. It was meant to be like a medical facility to treat, high blood pressure, diabetes, that kind of thing. However, due to the circumstances we're in right now, they have to treat massive casualties and multiple casualties in the ER. Last night, we heard ambulances coming. I ran down with a couple of my team members. Out of 6 people in, 3 died. So mortality is really high. We don't have ultrasounds in the ER. We don't have centralized. We don't have medications. We don't have anything to resuscitate patients with. So they just end up dying.
That is just absolutely horrific, what you're describing. I believe that you also know about the condition of our colleague, Ismail Abu Omar.
And I just want to make sure... Go ahead.
Yes, please continue.
And I just want to make sure that whoever listening to us understand that this has nothing to do with what is your political stand or what's your ideological background or what's your ethnic background. This has nothing to do with that. This has to do with a group of people that have been in a crisis situation and no hand's been extended to them to give them some support. We're treating children, we're treating women, we're treating elderlies, and mortality is really high across the board, and it's I can't believe in the 21st century we allow this to happen.
And you're treating
That's
people,
all.
and you're treating people who are supposed to be protected under international law, even during times of war, including journalists. I believe that you know about the condition of our colleague Ismail Abu Omar, who lost his leg in an Israeli drone attack. How's he doing?
Well, at this point, he's still critical. I just spoke with your one of your
Producers, I believe.
another. He needs to be transferred out ASAP because there's a high risk of losing another limb. Will be a bilateral amputee and maybe losing part of his fingers, and we don't have any equipment or resources to treat him locally here. He needs to be sent out.
Dr. Elfar, thank you very much for joining us and for really describing to us the situation at the European hospital, just one of few that are functioning in Gaza. Thank you for your time.
Thanks for having me on.